Hello and welcome to your education session on breathlessness management. I'm Annie Pritchard and I'm a respiratory physio and the team lead. The aim of the session today will be to understand why you become breathless, why being breathless matters and how you can manage your breathlessness. Perhaps the best way to start is to define what breathlessness means. For many, it's the awareness of the intensity of breathing, or as LeBoeuf said, I've been breathing all my life, but now I'm starting to notice it. Breathing is natural, it is subconscious, and to be honest, you've been doing it all your life. But now you start to notice it, and it can feel out of proportion to the activity you're doing. That can be frightening, distressing, but it is very subjective. So when you get breathless, it will be different for you to someone else, and other people may not understand. But there are things we can do to help make it better and improve your quality of life. So keep watching for some more tips. We'll start with thinking about some of the causes of breathlessness. Some of the causes of breathlessness can be simply lacking fitness. It could be that you're overweight, stressed or anxious, feeling low in mood, or simply have an altered breathing pattern. Although breathlessness is a common symptom of any lung condition, there are other factors that influence it. And by addressing these, you can actually improve your background level of breathlessness and improve your quality of life. We're going to look at some of the ways that you can manage breathlessness. The first thing I want to say is oxygen therapy is not a cure for breathlessness. And many people think by just having oxygen that will make them better. All oxygen therapy may do is help you to do more for longer with less intense symptoms. But actually there are some other things that you can do that are available to you right now, and that's what we're going to look at now. One of the simple ways to help you use your lungs better is to use your diaphragm more, and we call this diaphragmatic breathing. It's a relaxed type of breathing that tries to make use of the most efficient respiratory muscle you have, your diaphragm, that sits just under your lungs. So one of the ways to help you do that is you put one hand on your chest and one hand on your stomach. And what you're aiming to do as you take that deep breath in is your hand on your stomach moves and your hand on your chest stays still. We'll have a go practicing it in a moment. But what it will look like is a bit like this. And hopefully you'll see that my chest hand stays still, my shoulders stay relaxed, but actually my ribs on the side move out as I take that deeper breath in. We're going to have a practice together. Are you ready? One hand on your chest, one hand on your stomach. And you want to take a breath in through your nose into the bottom of your lungs, like you're blowing up the bottom of your lungs as a balloon. And try again. Ideally, when you take that big breath in, if you can hold it for a few seconds, it just allows the air to work the way down to the base. Now, for some of you, you'll find that quite easy. For others, that will be a little bit tricky. So there's a few tricks to help you. You can either put your hands on the outside of your ribs, so you can feel your rib cage moving out. But if you still find those shoulders are kicking in, so they're trying to take over, there's another trick. It might look a bit silly, but no one's laughing at you. Put your hands on your head. That stops your neck and your shoulder muscles from taking over and trying to raise your ribs up. And it just helps you to find that diaphragm and help it isolate the movement. If you try breathing into the top of your chest with your hands on, you'll find it's really hard. So that's one way you can try. The best thing to do is to practice this when you're relaxed and you're well. When you're already struggling, you'll panic and it won't be so easy. But if you practice it when you're well, it will come more naturally when you need it. Once you can do it very well, if you're using your hands on your head, one way to progress back is put one hand on your ribs. And as you feel more able to do that, you can bring your other hand down or revert back to that way, just to help you test. One of the other techniques you can use is called positions of ease. It makes use of positions that help your respiratory muscles work to the best of their ability. So when you've been doing something that gets you out of breath, by fixing your shoulder girdle, and we mean the area around here, it actually allows the muscles that otherwise are moving your neck and shoulders to help lift your rib cage, to help you breathe that little bit deeper and that little bit better. You'll find that you do this naturally anyway. Here are some other positions you can try that you may find helpful. Leaning forwards onto a chair, leaning onto a counter or a worktop onto your forearms. You can lean back against a wall or even sideways against a wall. Generally, wherever you go, there's a surface you can lean on. Have a look, have a try and find what works for you. I'm going to demonstrate some other positions you can use using a chair. When you're trying to recover from feeling breathless, you can use any item, like a chair, as long as it's solid. You can lean on your forearms. This supports your shoulder girdle and allows you just to control your breathing using your diaphragm. Alternatively, you can also just lean on straight arms, so you're fixing your elbows and again, just supporting your shoulders. The other position within a chair is sitting on it. You can lean on your forearms again. It does allow your stomach to move away from your diaphragm and for you to take deeper breaths. You can stay here as long as you like, just until you've regained control of your breathing and you feel that you're ready to move on. As you can see, these are all positions that are easy to adopt. But have you thought about when you're out and about, maybe when you're doing your shopping around a big supermarket, you can be using this position using the trolley? Also perhaps when you're walking along, this is why a walking stick or sometimes a four-wheeled rollator can be helpful if you really do struggle with breathlessness. They allow you to lean on something which fixes off that shoulder girdle and helps those additional respiratory muscles kick in, just to help your breathing and your recovery a little bit better. It's not a sign of weakness. It's helping you to live the life you want to live, independently, that little bit better. Some other tips that might help you manage your breathlessness include blow as you go, which we mentioned before. So it's breathing out as you make a strenuous effort. You can try pursed lip breathing, where you breathe out as if you're whistling or through a straw. This helps open up your airways behind and helps your lungs empty better. Also planning your day ahead. So you do things that require more energy when you have more energy. You might have a good day, you know that there might be a bad day later. So you plan your day and your week accordingly. What we want you to do is to have fun doing what you want to do, not the things that you just have to do. Also pacing when you're walking can help. So it might be that you breathe in for 2 steps, you breathe out for 2 steps. It just helps you regulate your breathing a little bit better and stops you just going back to using the top of your lungs. Some people find fan therapy helps. By this, you use a little handheld fan that you hold 15 centimetres away and you direct at the area between your nose and your eyes. This just helps stimulate the vagus nerve, which will relax your breathing down. And a lot of people find it really helpful. The other best way to help your breathlessness is to increase your fitness. As you recall, we'll say that's one of the causes of breathlessness. As we become more unfit, our muscles use more oxygen and they're not so efficient. So actually doing your pulmonary rehab course right now is one of the best things you can be doing for both your body and your lungs. So we hope you enjoy it. If you have any further information, you can use the British Lung Foundation website, which is www.blf.org.uk. But don't forget, you can also ask your clinician following your exercise session of any questions you have raised on this material. And we look forward to seeing you then. Bye.